Myla Taha, a first-year nursing student at Central Mindanao University. Today, I am going to do a procedure for the single most important infection control method called hand washing. Before we start with the procedure, we need to do an assessment, which is to assess for any of the above requirements for hand washing, like hands are visibly dirty, soiled, or in contact with blood or any body fluids and certain organisms. If no requirements are fulfilled, the caregiver has the option of decontaminating hands with soap and water or alcohol-based hand rub. For the possible nursing diagnosis, determine the related factors based on the patient's current status and for risks of infection. The materials needed for this procedure are a faucet with preferably warm water flowing from it, and today we are using a hand-operated handles since there are different types of faucet depending on the availability, like knee levers, foot pedals, elbow controls, which move this with elbows instead of the hands, and the infrared control, which detects motion in front of the sensor, causes water to start and stop flowing automatically. Next one is the antimicrobial soap. It can be liquid or bar soap, but today we are going to use a bar soap. Next one would be paper towels in patting our skin to dry, and of course, the last one would be a waste bin to throw our used paper towels. Since we're all set, let's start with the procedure. Procedure number 1. If you are washing your hands where the client can observe you, introduce yourself and the procedure and why is it necessary to do. Hi mga kawami mga nurse, for today ako si Myla Taha. Today kay ipakita na kasi mo ang pag-pinauspit ko at kikinin mo ang basic infection control method which is makahelp mo siya para ma-avoid mo sa contamination or risk ng infection sa mga hugo rin yung mabulitan. So, tanawin lang mga para mag-learn mo what you do. This is to establish a good rapport and reduce the anxiety of the patient, and also it enhances the cooperation of the client. Procedure number 2. Turn on the faucet and adjust the flow. The water splash from the contaminated sink will contaminate the clothing. Warm type of water is comfortable and is likely to open pores and remove oils from the skin. Organisms can lodge in rough, broken areas of the chapped skin. Procedure number 3. Wet the hands thoroughly by holding them under the running water and apply soap to the hands. You need to hold the hands lower than the elbow so that the water flows from the arms to the fingertips. Be careful not to touch your hands to the sink. If the soap is liquid, apply 4 to 5 ml or 1 teaspoon. If it is bar soap, granules, or sheets, rub them firmly between the hands. The water should flow from the cleaner area towards the more contaminated area. Hands are more contaminated than forearms. By using antimicrobial soap, it can remove microorganisms that may infect the nurse from the client or from the nurse to the client. Procedure number 4. Thoroughly wash and rinse the hands. Use firm rubbing and circular movements to wash the palm, back, and wrist of each hand. Be sure to include the heel of the hands, interlace the fingers and thumb, and move the hands back and forth. The friction caused by firm rubbing and circular motion helps to loosen dirt and organisms that can lodge between the fingers, skin, crevices of knuckles, on the palms and dorsal side of the hands, and on the wrist and forearms. According to the World Health Organization, this is the right way to wash your hands. Right palm over left dorsum with interlaced fingers and vice versa. You need to do this first here and on the other side. You should do this for 30 seconds. next one would be palm to palm with fingers interlaced. Another 30 seconds. Rub the fingers against the palms of the opposite hands. And the next procedure would be back of fingers to opposing palms with fingers interlocked. Another 30 seconds. The next one would be rotational rubbing of left hand, thumb clasped in right palm and vice versa. Seconds. And the next one would be in your wrist, your arms. And on the other side. Cleaning less contaminated areas like the forearms and wrists after hands being clean prevents the spreading of microorganisms from the hands to the forearms and wrists. Length of hand washing is determined by degree of contamination. Area under nails have high microorganism count and organisms may remain under the nails where they can grow and be spread to other people. The running water rinses microorganisms and dirt into the sink. Before we proceed to step number 5, we're going to wash now. So, from here down, careful not to touch the sink. Your hands will be contaminated. Wash properly. On the other side. Let's remove the soap. On the step 5, thoroughly pat dry hands and arms. Dry hands and arms thoroughly with a paper towel without scrubbing. Patting the skin to dry prevents the chapping. Pat, pat, pat. Here, here. Discard the paper towel in the appropriate container. We have the container here. And now, we need to turn off the water. Use a new paper towel to grasp a hand-operated control. Turning the faucet off with a clean paper towel protects the clean hands from contaminated sink. And we need to throw this to the trash can. Done.